Welcome, everyone. We are thrilled to have so many people joining us this afternoon to learn more about plastics' impact on human health, co-hosted by Green Needham and the League of Women Voters of Needham. My name is Kathy Reyes, and I am the team lead for Green Needham's Plastics Reduction Team. I am also a volunteer on the Speakers Bureau with Beyond Plastics, a national organization that strives to reduce plastic pollution through education, advocacy, and policy change. Following today's webinar, I encourage you to visit the Green Needham Plastics Reduction webpage, where you will find information about single-use plastic ban bylaws that we have recently passed in our town. Also, please check out Beyond Plastics' website, as it has a lot of great fact sheets regarding single-use plastics and ways that you can get involved. Links for both of these websites will be in the chat at the end of the presentation. I hope today's webinar will inspire you to reach out to your own town or city's green or sustainability team to see how you can support plastic and waste reduction initiatives. Now, Lana Zamoro from the League of Women Voters will introduce our guest speaker.
Good afternoon, everyone, and thank you, Kathy, for that start of our program. I have the honor and the pleasure of introducing Dr. Philip Landrigan, our presenter for the webinar. Dr. Landrigan is a pediatrician, public health physician, and epidemiologist whose work over 50+ years is focused on how hazardous exposures in the environment harm us all, but especially the health of infants and children. His research, in collaboration with others at the national and international level, has been used to develop policy to protect our health and our planet from disease. For example, his studies of lead poisoning and its effects on brain development while at the CDC in the 1970s demonstrated how toxic even low levels of lead are to children. His research contributed to the U.S. government's 1975 decision to remove lead from paint and gasoline, reducing blood lead levels in the USA by 95%, resulting in cleaner air, better health for all, and improved intellectual capacity for children. In addition to his work on lead poisoning, he has researched the dire health impacts of the 9/11 bombing on some 20,000 first responders and others, and the public health and climate impacts of pesticides, asbestos, and plastic pollution on the planet and us. He has been awarded the Meritorious Service Medal of the U.S. Public Health Service and is a frequent consultant to the World Health Organization. Since 2019, he has chaired the Monaco Commission on Human Health and Ocean Pollution. He chaired the Minderoo Monaco Commission on Plastics and Human Health from 2021 to 2023, which examined plastics' impacts on human health across the plastic life cycle and formulated recommendations to guide drafting of the UN Global Plastics Treaty, sadly now on hold. He is currently directing the Global Public Health Program and Global Observatory on Planetary Health at Boston College. Dr. Landrigan's contributions have been enormous through work at the national and international level. Impossible to fit into a 2 or 3 minute introduction. So I'm going to urge you to please click on his bio link to see the breadth and impact of the work he has done to date. On a personal note, I would like to say that as trust in science and our public institutions in science, that trust in science at our public institutions has been eroding for some time now. Dr. Landrigan represents the best of public servants.
My topic today, I'm going to talk about plastics, but I'm very specifically going to focus on plastics' health impacts. And this is a very deliberate choice. I think when for a long time, all of us, when we think about plastics at all, think about the waste, the plastic waste that piles up on beaches, the litter along highways, the plastic bags that you see stuck in trees and bushes and so on, all of which is important, all of which is contributing to the damage of ecosystems. But what's now become clear that in addition to all of those ecosystem effects, plastics harm human health. And let me begin by just telling you what my key messages are going to be. And these are the headlines, and then we'll we'll delve into the details. The first is that plastics are indeed a very serious danger to human health and the health of the planet. And very specifically, they cause disease and death all across the human lifespan, beginning with infants in the womb, to kids, to adolescents, to adults, people at our stage of life. And these impacts occur at every stage of the plastic life cycle. And I'll talk about the plastic life cycle in a moment and explain what I mean by that term. But this is the bottom line, that plastics harm health. So let's begin. Some of you will know this very well, but just to make sure that everybody's starting from the same place, let's just talk about what plastics are, what they're made of. So basically, plastics are a class, really multiple classes of synthetic chemicals, manufactured chemical materials. And this point is very important, and I don't think everybody fully appreciates it, that 98% of plastics are made from fossil fuels. They're made from gas and oil in this country. In other parts of the world, like China, they're made from coal. But in any case, plastics are made out of fossil fuels. And the reason they're made out of fossil fuels is that plastics are basically made out of carbon, and fossil fuels are a cheap, environmentally destructive, but cheap source of carbon, and hence they're the main source of plastics. And all plastics have two components. Firstly, they have what's called a polymer. So a polymer is a big molecule, something like polyvinyl chloride or polystyrene, polyethylene, all those words that have the poly element in them. And this is the big molecule that gives the plastic its structure. And then thousands of additional chemicals are blended in to the polymer to give it color, to make it flame retardant, to help it resist ultraviolet light, on and on and on. There's a whole long list of chemicals that are added. And here's a picture that illustrates what I was just saying. So what you're looking at there is a polymer. The black circles here are the carbon atoms that are the backbone of the thing, and they're held together by what's called carbon-carbon bonds. That's the fundamental architecture of any plastic that exists. And then all of these other chemicals, phthalates, bisphenols, PFAS, flame retardants, and many others are popped in. Important to note that most of these other chemicals are not chemically bonded to the polymer. They're sort of blended in when the polymer is made. They can comprise at least 50%, in some instances up to 70% of the total weight of the plastic. And because they're not chemically bonded to the polymer, they can leach out when the plastic is heated up. For example, if you put plastic in the microwave, it heats it up, these chemicals come out. If a plastic bottle, a drinking water bottle, sits in the sun and absorbs solar energy, these chemicals can get out and get into the water that you drink. One more reason not to use plastic water bottles. So a few big trends in plastic production. Basically, commercial plastic production began right after World War II. What had happened was that back during the war, so during the 1940s, the United States government was very much afraid that they were going to run out of strategic materials like rubber, gasoline, other chemical materials. And so the government worked with companies like Exxon and Shell to build huge concentrations of petrochemical plants, some down in the South Jersey, Philadelphia area, the biggest cluster in southern Louisiana and Texas along the Gulf Coast, and a third cluster out in Southern California, a few elsewhere, but those were the big areas. And they built these big plants. And then after the war came to an end, the plants were sitting there. The various companies picked them up generally at very low price and repurposed them to make civilian materials, mostly plastic. And since that time, since 1950, about plastic production has increased 250-fold, and I'll show you a graph in a minute. It's on track to double and triple by 2060. And at the same time, you have to bear in mind that plastic recycling rates are extremely low. They're way below the recycling rates for glass or aluminum or paper or cardboard or steel. And the reason they're so low, it's not that people don't care. I mean, I see the kids here on the campus at Boston College very conscientiously, very diligently putting their scrap plastic into the blue bin. So the problem's not about individual behavior. The problem is that once the plastic gets into the waste stream, most of it is just not recyclable. It's so chemically complex. There are so many different types of plastic. They can't be mixed together. They don't go together. And the stuff either ends up being put in landfills or burned or shipped overseas to some of the world's poorest country. And in the environment, once they're landfilled or shipped out, they break down into the microplastic particles and the even smaller nanoplastic particles that I'm sure you've been reading about in the last few years. And these particles are very, very persistent in the environment. They can last for years, even for decades. So out of this, so you have this combination of increasing production, very low recycling rates, and very long persistence. That is a recipe for environmental disaster. And because of those three factors, plastic pollution is increasing. It just does not break down for the most part into its constituent elements. And so an estimated 8 billion tons of plastic waste now pollute the planet. This is roughly 80% of all the plastic that has ever been made. So the stuff is almost immortal in the environment. It causes damage to ecosystems, and human exposure, not surprisingly, is increasing. It's increasing every year to the big plastics that you can see, the micro and nanoplastics, and the plastic chemicals. So most of us are old enough to remember Life magazine, and this was an article in Life back in August 1955 talking about the joys of throwaway living. And it was a long subtitle that talked about how this family would take 40 hours to clean all those products, but now they don't need to worry anymore. They can just throw them away and get on with their lives. That was the message. And it was very cleverly, very skillfully marketed by the plastics industry. And that's why we are where we are today. So this is a graph illustrating what I showed you a minute ago, that plastic production has started here in the 50s, slow at the beginning, but then it ramped up, and now it's accelerating, and it's poised to accelerate still further over the next 25 years to mid-century, with a huge fraction of current production is going into single-use plastic, stuff that you use once and throw away. Think of plastic bags from the store, plastic bags from the dry cleaner, Starbucks cups, a million things that people use once and they toss, is what a huge percentage of plastic, and that percentage is growing year to year, and then very low recycling. So you might ask yourself, why is plastic production increasing so rapidly? And to understand this, you need to understand the structure of the plastic industry. Basically, the main plastic producers are the big petrochemical companies, Exxon, Shell, Dow, Sinopec in China. Those are the big guys. And they can see, they're not stupid, they can see that the market for gasoline is going down, the market for diesel is going down, the market for home heating oil is going down, the market for gas is going down. Not as rapidly as I would like, not as rapidly as most of you would like, but they can see the trend is definitely downward. It's now extremely cheap to generate electricity from sun energy and wind. In fact, in many parts of the United States, it's actually cheaper to generate electricity from sun and wind than from any fossil fuel, even gas. And they know that. And so they are pivoting, and they are pivoting away from making gasoline and into making plastic. At the same time as they can see the market for gas and oil going down, they're sitting on more gas and oil than they've ever had before. And that's due to fracking. The United States is now the world's largest producer of gas and oil. In the United States, we produce more gas and oil than Russia. We produce more gas and oil than Saudi Arabia. We produce a lot more than Venezuela. We are the world's largest producer. So the industry is really in a pickle. The market for their product is going down. Their feedstocks are going up. And so what they're doing is they're diverting their production into plastic. And what they're doing to make that happen is they are building these enormous factories called cracking plants, which stands for catalytic crackers, which take gas and to some extent oil, break it down into small molecules, and then rebuild it as plastic. And single-use plastics are at the center of this strategy because single-use plastics need to be replenished every single day. Unlike structural plastics like cars and airplanes that last for years or decades, single-use plastics need to be replenished every day, and therefore they are a boon to the market. And the engineers at the plastic companies are working day and night to come up with more and more ways to put plastic into every corner of our lives. Just think back 5 or 10 years. Stuff that used to be wrapped in paper, or foods that used to come in glass jars, they now come in plastic. And that's no accident. It's because the industry has been working very diligently to push those products out. This is way too complex, but I want to just show you a couple of highlights. Focus on this white box up here at the top. Can you see my cursor? Is that something you can see there? Maybe, okay. Anyway, this is the plastic life cycle going from left to right. It starts with extraction of gas and oil. That the gas and oil have to be shipped to a factory where plastic is made. That's basically raw plastic. That stuff is shipped to yet another factory where products are produced. Then it gets shipped to us by Amazon and all the wonderful things that we use in our daily lives. A small fraction of it gets recycled, and more than 90% of it gets disposed of by landfilling or burning or dumping into the ocean. So that's the plastic life cycle. And what the rest of this slide shows, which I will not go into detail, is that there are toxic exposures at every single stage of that life cycle. And those toxic exposures in turn lead to a whole range of diseases that you can see down here at the bottom. Everything from mental health problems to neurological diseases, to heart disease, to stroke, to cancer. There was a big paper published just a couple of weeks ago in one of the major medical journals, which comes to the conclusion that approximately 10% of all deaths from cardiovascular disease in this country are due to exposures to plastic chemicals. So these are not marginal problems that affect 1 or 2 people in 1,000. These are wide-scale exposures that are resulting in widespread disease in a significant fraction of the American population. So let's go into that in a little more detail. So in oil and gas extraction, you've got several health issues. First of all, there's the occupational hazards to the men and women who work in those trades. And then secondly is the pollution of air and water in the communities that surround fracking wells and plastic production facilities. The production is very energy intensive. It generates large amounts of pollution. If you've ever driven down the Jersey Turnpike through Elizabeth, New Jersey, or South Jersey near Camden, you've inhaled some of that stuff. When we use plastic in our daily lives, when you drink out of a plastic bottle, when you put a Tupperware container into the microwave, chemicals and microplastic particles get released from those plastic goods. They get into the environment. when little kids chew on a rubber ducky in the bathtub, they're getting lots of microplastics and plastic chemicals like phthalates into their bodies while they're taking their bath. And then when the stuff gets burned, it generates lots of nasty air pollution. When it gets put into landfills, firstly, it costs cities and towns a lot of money to deal with all the plastic waste that's been building up year to year to year. And then when those plastic materials are put into landfills, they break down, the chemicals leach out, and they get into groundwater. And all of this stuff is worsening as plastic production increases. And if any of you have a problem with insomnia and wish to get into it in more detail, there's a link down there at the lower left that will bring you to a lot of information about these harms to health. So here come a few slides showing pictures of these operations. This is a picture of a fracking well out in North Dakota. Fracking wells are enormous operations, very energy intensive, very polluting, very dangerous for the workers who do the work, and very dangerous for the communities nearby because of all the pollution that they generate and all these big trucks running up and down rural highways carrying chemicals and other solutions to the fracking well. Oops, sorry. Then let's see, we skipped a couple here. Then this is what happens when plastic intermediaries are transported. This is a picture from that terrible rail disaster that occurred a couple of years ago in East Palestine, Ohio. East Palestine is just outside Pittsburgh. And a train carrying vinyl chloride monomer, which is a plastic chemical which was moving from one factory to another, turned over, caught fire, generated this toxic black smoke that contained benzene and dioxin and hydrochloric acid and many other chemicals that you don't want to inhale. Then here's a picture of a plastic production complex down on the Texas Gulf Coast, and you can see the visible pollution, and just imagine the toxic soup of chemical exposures that confront the workers inside the plant. And many of these plants are situated in poor, Black, Native American, indigenous communities in the southern states, where you have these big factories 20 yards from these little houses where people live. Many of these factories are right along the Mississippi River. They're actually on lands that were cotton plantations before the Civil War. And most of the workforce there today are the folks who are the descendants of the Black slaves that worked in Louisiana and Mississippi and Texas and so on. And then this is what happens when the waste gets shipped overseas, which is about half of the plastic waste gets shipped overseas. And you can see it piles up on beaches. And what's going on here, these little kids, they're not playing, they're working. They're looking for those little bits and pieces of plastic that have monetary value that they can put in their bag, take to the market, and get $1 or $2 to keep body and soul together for another day. Okay, so I mentioned at the beginning the chemicals in plastics. Let me dig into that a bit more now. Those phthalates and bisphenols and other chemicals that are in there, they include carcinogens capable of causing cancer, developmental neurotoxicants. These are chemicals that can damage the developing brain of an infant in the womb. If a pregnant mom gets these chemicals into her body, they will go, for the most of them, will go right through to the baby. And many of them end up in the brain where they can cause brain injury, shows up as loss of IQ, increased risk of autism and ADHD, various behavioral problems. Some of the chemicals are endocrine disruptors. They can get into the bloodstream of people at every age. Phthalates are one nasty class of endocrine disruptors, which are responsible for birth defects of the male reproductive organs and decreased male fertility. BPA, which is bisphenol A, gets into the liver It interferes with cholesterol metabolism, results in elevated serum levels of cholesterol, which in turn increase risk for obesity, for diabetes, for heart disease, for stroke. And it's the combination of these two chemicals that are linked to that 10% mortality from cardiovascular disease in the United States that I mentioned a few minutes ago. And beyond that short list of chemicals where we have a pretty fair understanding of the hazards to health, you have to understand that 75% of the chemicals in plastic have never been examined to see if they're hazardous or not. We just don't know. We're flying blind. And I don't think most Americans realize that when you go to the store, when you go to Home Depot or Target or some other store to buy plastic goods, you sort of think because they're nicely wrapped, beautifully presented, that somebody must have tested them for toxicity. But the answer is that 75% of them have never been tested. They're put into these products, put into plastic products, put out on the market, and it's up to the public health scientists, the state agencies, the federal agencies to discover the fact that these chemicals are causing harm, sometimes years, even decades after they've been brought to market. It's really a broken regulatory system. So here's where we are. We have thousands of chemicals on the market today, many of them in plastics, maybe 20 plus or minus where we have good hazard data, a couple of hundred more where we have some information, and then thousands upon thousands where we just don't know what we're being exposed to. And these chemicals are in us. The CDC does something called the National Biomonitoring Survey. It's a rolling survey that goes through the American public every year. And they routinely find between 200 and 300 manufactured chemicals, including many plastics chemicals, in all of us, from infancy to nonagenarians. We all have these chemicals in our body. And here's a summary listing of the diseases that those chemicals cause at different stages of life. At the earliest stages of life, they increase risks of miscarriage, low birth weight. They cause reproductive abnormalities. They interfere with brain development. In children, they interfere with thyroid function. They increase risk for asthma. Across the lifespan, they cause obesity, diabetes, heart disease, stroke, endometriosis, polycystic ovary syndrome, decreased sperm count in men, which translates to decreased fertility, and increased cancer deaths. These are nasty chemicals that we have allowed to come into our lives, and we are paying a price for the convenience that they bring. And as a pediatrician, I always feel compelled to emphasize that it is the infant in the womb, the human fetus, that is the most vulnerable member of our society to any of these chemicals, because when during early development, there are windows of susceptibility, windows of vulnerability that simply have no counterpart in adult life. Chemicals that will bounce off you and bounce off me can cause really serious damage to the infant in the womb that results in brain damage or birth defects or cancer. We now know that there are simply no safe exposure thresholds in early life. The only effective way to prevent those adverse health effects is to prevent exposure from occurring in the first place. I want to say a word. It's not my main topic today, but it's important to bring in briefly the fact that plastic production is tied to climate change. And the connection is that plastic production requires enormous amounts of energy. Those factories that I showed you, the fracking wells, the production facilities require huge amounts of oil and gas to run them, because all of those chemical reactions require heat to drive the reactions. And because they're burning lots of fossil fuels, they're generating lots of greenhouse gases. About 2.5 gigatons per year at the present time, which is more than the whole nation of Brazil puts out in a given year. And that's going to go up. It's going to, as plastic production goes up, the increase in greenhouse gases is going to track it. Also, and this is an important point to bring out when you talk to policymakers, that plastics have costs. The costs are hidden because they're not neatly collected in one place. You have to have a smart team of economists to pull these costs together from various databases. But when you look at these costs, you have healthcare costs, with the costs of hospital bills, doctor bills, medications, and so on. There are productivity losses. Those are the economic losses that result when a person falls sick or dies prematurely because of plastics, and therefore they can no longer contribute economically. That's a productivity loss. And when you put those figures together, the amounts, the damage is massive, into the trillions of dollars per year. And these are undercounts because we only have data from a fraction of the world's countries. And of course, these costs are not borne by the fossil fuel industry. They're not borne by the plastic industry. They're externalized, and they basically fall on you. They fall on me in our taxes, in our health insurance costs. They're basically dumped on society while the industry profits from producing these toxic products. And all of these harms fall disproportionately upon the poor people in Louisiana, Mississippi, Texas, who live beside the plastic production plants in our country, and the poor people overseas, like this woman in Ghana, West Africa, the people who live and work near those plastic waste dumps that accumulate in low-income countries. I want to approach the end of this talk by talking about microplastics because they've been very much in the news of late. So microplastics, as I said earlier, are the tiny plastics that result when plastics break down in the environment. And they're in air, they're in water, they're in foods, they're in the soil, and they get into us. They get into us through our food, through water, even through inhalation of invisible particles that are suspended in the air. And in recent years, scientists in this country and around the world have been looking at various organs in the human body, and they're basically finding microplastics and their small cousins, nanoplastics, everywhere where they look. There's still some controversy about how much. Any of you read The Guardian? There was a big article a week or two ago talking about the disputes among scientists as to exactly how much microplastic and nanoplastic is in the human body. But there's no question it's there. It's absolutely no question. And it's going to get worse as plastic production continues to build up. And like plastics themselves, plastics are made of polymers and all of the chemicals. And that matters because when microplastics get into an organ in the human body, like the liver, like the lungs, they think of them as Trojan horses. They carry those chemicals into the tissue with them. And then once the microplastic is lodged in the liver, it releases the chemicals where they can cause damage right into the cells. And this is a paper that has received a lot of attention from the University of New Mexico, showing that over the last 30 years since the 1990s, the concentrations of microplastics in brain tissue appear to be increasing. One of the most striking findings about microplastics was a paper published 2 years ago almost in the New England Journal of Medicine by a group of cardiologists in Italy. They looked at 312 patients who underwent a procedure called carotid endarterectomy. So the carotid artery, everybody has two carotid arteries, one on either side of the neck. And these are the main arteries that run from the heart up to the brain. And this yellow material that you see here, this is arteriosclerosis. This is what's called an arteriosclerotic plaque, an accumulation of fatty tissue on the inside of the carotid artery. Not something you want to have because it increases your risk of stroke. And so when physicians discover that a patient has a carotid artery plaque, they recommend carotid endarterectomy. That's a procedure whereby a catheter is run into the blood vessels, either in the groin or on the arm, run up through the heart and up into the carotid, and like a little roto-rooter, it sucks out that tissue. And very effective procedure, very good at preventing stroke and other bad consequences. And so what these cardiologists in Italy who did this study did was they took 312 patients through this procedure. They removed that tissue and they took the tissue back to the lab and they looked at it under the microscope. And they found that nearly 60% of the patients, 58% of the patients, had microplastic particles visible in that plaque tissue. Then they followed those patients. They followed the people that had the microplastics, and they also followed the people that did not have microplastic particles. And they found that the folks who had the particles in their arteries had 450% increase in the risk of myocardial infarction or stroke or death over the next 3 years. So clearly there's something going on here. It's only one study. It certainly does not prove cause and effect, but it's certainly a striking finding and it cannot be ignored. It has to be followed up. And actually follow-ups are going on now. A number of studies have been published in the last couple of years, finding microplastics in multiple tissues and suggesting that they may be linked to a range of diseases. I don't want to lean too heavily on any of these studies because they're mostly preliminary, mostly small numbers of patients, but and the analytical methods are still all over the place. But it's very clear that there's something going on here with microplastics and we need to get more information and get it quickly. We use a lot of plastics in healthcare, in medicine and nursing. We didn't used to. This is from 100 years ago. Here are some nurses at Mass General in the 1919 influenza pandemic, and look at what they're doing here. Their gowns are made of cotton, as are their masks, as are their caps. What they're doing here is they're folding cotton masks that have come from the hospital laundry. So in other words, they're reusable masks that will be used, tossed, laundered, and then brought back upstairs and folded. And contrast that with what happened 100 years later in the COVID pandemic. Everything was plastic, the gowns, the masks, the caps, the booties. Huge amounts of plastic were generated during COVID in hospitals. And in the last few years, leaders in the health profession are saying, we need to untangle necessity from convenience. And what they mean by that is we recognize that there are some uses of plastic in medicine that are probably unavoidable. Think of intravenous tubing, for example. Think of endoscopes. There's some uses where you just got to have plastics. But those syringes don't need to be plastic. When I started out at Boston Children's, the syringes were made of glass. This bottle doesn't mean to be made of plastic. It could be made of glass. A lot of the plastic stuff that we use in hospitals could be replaced with reusable materials, and some healthcare systems are beginning now to swing back, and they're actually saving money because they're not having to purchase hundreds of thousands of plastic objects, and they're not having to pay waste disposal fees to get rid of the stuff. So as we conclude, it's clear that there's need for action on many levels. Plastic is a complicated problem, and no one solution is going to do everything. So firstly, we can take action in our own homes. We can do our best to purchase less plastic. Can't get away from it completely. Don't beat up on yourself when you realize you can't get away from plastic completely. But think about carrying a cloth bag to the market instead of taking a plastic bag home. To the extent you can buy fruits and vegetables that are not wrapped in plastic, you should buy that. Don't buy plastic water bottles. The water that comes out of the tap in Boston comes from, or in Needham or pretty much anywhere around Boston comes from the Quabbin Reservoir. It's some of the best water in North America, and I encourage you to drink it out of an aluminum cup, not a plastic cup or ceramic cup. Never heat food in microplastics, because when you heat soup or any other food in microplastics, the heating process drives the chemicals and the microplastics into the food. So those are things that's a short list of some of the things you can do in your own home. At the local level, we can ban a lot of plastic products. Right now, Senator Rauch has a plastic reduction bill, S2541, pending in the state legislature on Beacon Hill. Over in New York, they're pushing Beyond Plastics is pushing very hard for a big law that would reduce plastics in packaging in New York State. California has a fairly strong law on the books. But you must understand that whenever one of these laws is proposed at the state level, the plastics industry, which is really the petrochemical industry, pushes back, and they push back hard. They have hundreds of well-paid, well-fed, well-clothed lobbyists who are on Beacon Hill, who go to Sacramento, who go to Albany, who go to Washington, and do everything they can to prevent any rollback of plastic. And we just have to be prepared to push back against them, because they're always going to be there. They're not going to go away. It is not possible to reason with them. All you can do is push back and make the representatives and the senators understand that they will lose your vote if they don't take action to slow plastics. I've already talked about the healthcare sector. At the national level, I don't think we're going to get much out of the national government for the next few years, but actions that have been taken in other countries have been to ban plastic bags. For example, some African countries, Kenya and Rwanda, have completely banned plastic bags, and you can actually go to prison in Rwanda if you're found to have a plastic bag. And finally, at the international level, the UN is working slowly on a global plastics treaty. The process began back in 2022 when they adopted a resolution to come up with a treaty. But the problem since that time has been that the plastic and petrochemical industry have done their best to oppose a treaty at every stage of the game. If a treaty is going to be effective, if it's going to protect human health, it needs most fundamentally to understand that plastics harm health. That plastic is not just pollution, which is one of the lines that the petrochemical industry is pushing. It's not just pollution, it's a health hazard. It's a health hazard. And if we're going to preserve human health, we need to put some kind of a cap on the production of new plastic. We simply cannot continue on a pathway where global plastic production is going to double by 2040 and triple by 2060. It is not sustainable. It will overwhelm us. It will pollute us. It will generate greenhouse gases that overheat us. It is not sustainable. We need to cap that. And we need to control those thousands of chemicals in plastic. And of course, like any treaty, it needs to be adequately financed, because some countries in the world don't have the resources to do it themselves. So at the same time as the UN is moving slowly, we hope anyway, moving forward on a treaty, a group of us at Boston College, at Heidelberg University in Germany, at the Woods Hole Oceanographic Institution down in Falmouth, and a number of other universities across the world, have teamed up with The Lancet, which is the world's most widely read medical journal published out of London. And we have established what's called the Lancet Countdown on health and plastics. And what this is going to be is it's going to be a global monitoring system. We are in the process right now of identifying a series of indicators that we can use to track plastic production, plastic exposure, the burden of disease caused by plastic, and measure that stuff and build on the fundamental principle of public health that once you can measure a health effect, you can begin to set targets and you can begin to reduce it. And that's what we're trying to do, is to see how much damage is being done and then use that information to assess what we can rationally do to reduce plastics harms to health. And the Lancet has had a countdown on health and climate change for the past decade. It's been very effective at pushing the message that climate change is not just an environmental problem, it's not just a problem of the atmosphere, but it actually affects human health. We're going to convey exactly that same message when it comes to plastics, and here is a website that will take you to that. And as I conclude, I think this is the takeaway message, that the greatest risk here lies with taking no action. We have to get our act together. We have to recognize that we're dealing with a widespread problem that for too long has been invisible. Now we're trying to make it visible and take action against it. And at the end of the day, as senior citizens, all of us, we have a responsibility to be good ancestors and leave the world in a sustainable form for our kids and our grandchildren.
So thank you so much, Dr. Landrigan. That was a really awesome presentation full of so much great information. So we are going to switch over to the Q&A, and this is just a reminder that the hand raising and the chat are disabled, and all of your questions would need to come through the Q&A box, which is located in the black bar at the bottom of the screen. Excuse me. You can type in a question at any time, and we're reviewing them and trying to combine them when appropriate to avoid redundancies. We'll do our best to get through as many questions as possible in the time allotted, but I can tell you a lot have come in, so we'll get right to it. Our first question comes from Dr. Burton Jaffe, and he writes, as a physician myself, I would be interested in knowing if there are any long-term animal studies to detect abnormal testing or pathology in microplastic-fed animals. And are these microplastics in animals and humans sequestered in the lymph nodes, spleen, or kidney?
Yeah, thanks, Dr. Jaffe. It's good to hear from you. So there's been a great deal of experimental study in animals and subcellular and cellular systems done on plastic chemicals, on phthalates, bisphenols, and the rest of them. And the combination of high quality toxicologic studies coupled with epidemiologic studies has taught us what we know about plastic chemicals. The research on micro and nanoplastics is in a much earlier stage. As I mentioned, pathologists have detected micro and nanoplastics in pretty much every organ of the human body in which they've looked for them. But elucidation of the toxic consequences of having those particles in the body is still at a very early stage. I think people are still struggling to even come up with basic methods to decide, for example, how to expose experimental animals to microplastics or how to measure microplastics in tissues. It really is early days for microplastics. So at the present time, most of the knowledge base pertains to the chemicals in plastics.
Great. And another question came in. How dangerous are the Nalgene, the BPA-free water bottles often used for hiking and camping?
Well, those bottles are made of polycarbonate plastics, which means BPA. In my own life, I have switched to an aluminum drinking bottle. And I go out to the bathroom and I fill it up with beautiful Quabbin water from the tap, and so I'm not drinking water out of a plastic bottle nor from a plastic cup.
What have you found to be the most significant obstacles to passage of legislation or policies to protect people and the environment from toxic pollutants?
Well, without question, the biggest obstacle is the chemical industry, which is also the fossil fuel industry. They're all the same companies. And they are extremely well funded. Under current law, they're allowed to put vast amounts of money into political campaigns. They deploy lobbyists at the state and federal level in this country and overseas. Their presence is unrelenting. They oppose every single measure that the public health community proposes to reduce plastic exposure. And the only way to counter that is to mobilize the voters, as we are doing here this afternoon, get people to understand the problem, and then vote appropriately.
And a few people have asked questions about silicone. What are the health impacts of silicone? And many people are replacing plastic with silicone. Has a lot of research been done to say that silicone is actually safer?
Yeah, I honestly don't know as much about silicone as I do about plastics. I would suggest that if you're getting away from plastics anyway, go to the extent possible to glass, to ceramic, to aluminum, all of which we know are quite safe and also quite recyclable. Silicone, after all, is itself a manufactured chemical product.
What is the impact of burning plastic as a method of disposal, like incineration, and why are plastics burned?
Well, plastics are burned because they can't be recycled. And in some places they're burned for energy. They're actually put into furnaces to generate heat. The problem is that when you burn plastic, you generate a whole series of pollutants. You generate greenhouse gases that contribute to climate change, and you generate particulate air pollution, PM 2.5, which is associated with asthma and heart disease and stroke and even dementia. And finally, you generate a number of toxic chemicals, benzenes, dioxins, styrene, butadiene. All of those can be vaporized and get up into the air and then ultimately get into people, especially people who have the misfortune to live near waste incineration facilities.
And if all those chemicals are in the air, someone else asked, are there any home filters that you recommend to either help with air or dust, and kind of containing the microplastics and nanoplastics?
Yeah, well, it's certainly been shown that in-home air purifiers reduce exposure to PM 2.5 air pollution. And to the extent that these other chemicals are carried on the PM 2.5 particles, the use of an in-home air filter probably will reduce your exposure, although I've not seen hardcore studies on that point. It seems a logical conclusion.
Can you speak a little bit to the hazards around black plastic? And is black plastic more dangerous than other types of plastic?
Yeah, the particular hazard of black plastic is that it's full of a class of chemical called brominated flame retardants. And those chemicals leach out of the plastic, and they are known to be toxic to the developing human brain. So the folks in the population who are at greatest risk of black plastics are pregnant women because of the baby that they're carrying, and young kids. And it's interesting, the town of Brookline, I know Brookline's a fairly small town, so it's a manageable school system, but they're in the process of totally getting rid of plastics, and particularly black plastics, from all dining facilities in their schools, and going back to metal trays, crockery, dishes, and cups, and metal utensils. They had to spend some money up front to bring on some more staff and to buy dishwashers and so on. But the folks over in Brookline have told me that once they get over that initial expense, that they're actually saving money because they're not having to spend money every month to buy new plastic materials, and they're not having to spend money to dispose of tons upon tons of plastic waste.
And while we're on the topic of schools, can you speak a little bit to the idea of around turf, artificial turf, and is that dangerous for our kids to be playing on?
Yeah, so artificial turf is basically a chemical product. There are several different formulations. The worst artificial turf is the stuff that uses crumb rubber pellets between the green plastic blades of grass And those pellets are loaded with toxic chemicals, benzene, lead, styrene, butadiene, and the chemicals in those pellets can vaporize on a hot day, and the vapor hangs a few feet above the playing field, right where the children are playing. Another problem with synthetic turf fields is that they radiate heat, and on a hot summer afternoon, temperatures of 130, 140 degrees are measured 3 or 4 feet above the surface of those fields. And then when those fields reach the end of their life, after maybe 10 years or 15 years, it becomes a very expensive proposition to get rid of them, because in many jurisdictions they have to be dealt with as hazardous waste, which entails very expensive disposal. You can't just toss them in the trash and make them disappear. You got to pay serious haulage fees to get rid of the materials. So of course, the proponents of turf fields push very hard. They make we've probably all heard the arguments that they enable the children to play 365 days, 12 months a year. But you can get there. You can accomplish those goals by building properly designed grass fields that have proper drainage. And many cities and towns across the country have now installed grass fields that last for decades, that don't have toxicity, and will not involve any expensive disposal fees a few years into the future. So I think it's one more. The synthetic turf fields are one more example of the plastic industry's very skillful efforts to infiltrate plastic products into every corner of our lives.
We're coming up at the top of the hour, so I was just wondering, did you have any other closing remarks that you would like to share, Dr. Landrigan?
No, I would just like to thank the League of Women Voters of Needham and Green Needham for organizing this, a magnificent job of bringing so many people together. My screen says that right now that there are 209 people on there, which is just extraordinary. So well done. And let's hope that the message goes forward to Beacon Hill and beyond.
Excellent. Thank you so much, Dr. Landrigan, for the very interesting and informative presentation. It's a lot of information to digest, and I just want to remind our audience that this webinar was recorded and will be emailed to everyone who registered. It will also be available in the coming days for viewing on the Needham League of Women Voters website and the Green Needham website. Please refer friends and family who could not attend today to one of those sites so that they can learn about the negative health impacts of plastic production and pollution. We hope this webinar inspires you to take action. On a personal level, you can take steps to reduce your usage and exposure to single-use plastics. We will put a link in the chat now to a list of easy swaps you can make in your home. You will also see a link to the Green Needham Plastics Reduction webpage and the Beyond Plastics fact sheet page. We encourage you to reach out to your own town or city's green or sustainability teams to see how you can support plastic and waste reduction initiatives at a local level. In addition, contact your state representatives to let them know about your support for statewide legislation to reduce plastic waste. Our follow-up email will include bills that are supported by the League of Women Voters of Massachusetts. Make your voice heard. Thanks again, Dr. Landrigan, for a great presentation. And thank you to all of the co-sponsors and supporters, including many Leagues of Women Voters groups from around the state. Thanks for attending our webinar, and have a great evening.